Now next is larynx anatomy. So you can see the larynx extend from the epiglottis to the lower border of cricoid. So you can see this is the lower border of cricoid and this is epiglottis. Here somewhere you will get the epiglottis and this we are seeing from the front, so you will not get here. Okay. Now it has three pair of cartilage and three pair of unpaired cartilage. So paired cartilages is arytenoid, corniculate and cuneiform. Okay. Unpaired cartilages is epiglottis, thyroid and cricoid. So you can see this is thyroid cartilage, this is cricoid cartilage and epiglottis is somewhere here. So this is unilateral cartilage, unpaired cartilage. Now paired cartilage, that is arytenoid and corniculate and cuneiform. So you can see this is epiglottis. Now this is arytenoid cartilage, this is cuneiform cartilage. Okay, this is cricoid, this is tracheal rings. Okay, so this is thyroid cartilage. You can see this is epiglottis, cuneiform, arytenoid. Okay, so these are the paired cartilage. Now the thyroid, so you can see thyroid, so 2 ala or lamina. So these are the thyroid cartilage. 2 ala is connected, okay, and meet in the midline. In males it is 90-degree. Oblique line is present. So TTS muscle origin, that is thyroid, thyrohyoid, sternothyroid and thyropharyngeus. So at the oblique line these three muscles originate. Okay, epiglottis is in the form of leaf, cricoid is this complete ring. Okay, arytenoid on the surface of cricoid, on the apex of cricoarytenoid, arytenoid, that is corniculate. Okay, now we have extrinsic membrane, this is thyrohyoid and cricotracheal. So cricotracheal, you can see this is cricotracheal somewhere here, this is cricotracheal, this is cricoid and trachea. So between there this is extrinsic membrane, so it is cricotracheal and it is thyrohyoid membrane. Okay, now the hyoepiglottic ligament, hyoid to epiglottis. Okay, now we have intrinsic membrane. So intrinsic membrane is quadrangular conus elasticus. So what is quadrangular? Between the epiglottis and arytenoid. Okay, so you can see this is the inside of larynx and you can see this is arytenoid and this is epiglottis. So there is a membrane, that is quadrangular membrane between the epiglottis and you have to imagine inside it. Okay, so there is a membrane, so quadrangular membrane between epiglottis and arytenoid. Okay, and the upper part of that form the aryepiglottic fold and lower form the false focal cord. Now the conus elasticus, so membrane in the form of cone, cricovocal membrane and upper border form the true vocal cord. So you have to understand we have two extrinsic membrane. I have already discussed with you, that is cricotracheal membrane and you can see this is cricotracheal membrane, cricotracheal ligament and this is thyrohyoid membrane. So these are the extrinsic membrane. Now what is intrinsic membrane? So intrinsic membrane we have two, that is quadrangular space and quadrangular membrane and conus elasticus. So quadrangular membrane is between the epiglottis and arytenoid. So it is between the epiglottis and arytenoid. So it is forming like a quadrangular. Okay. So upper border is from the aryepiglottic fold and lower border from the vocal cord, false vocal cord, and conus elasticus is below here. So conus elasticus, upper border from the true vocal cord. It is in the form of cone, it is cricovocal membrane. Okay. Now various cavity in larynx. So between the quadrangular membrane, that is vestibule. Rima vestibuli, it is between the false vocal cord. This is false vocal cord and another. So it is between the true and false, it is ventricle. Okay. Now the rima glottidis, so it is between the space between the true vocal cord. Now the spaces, so pre-epiglottic space, paraglottic space and Ranke space, three type of spaces we have in larynx. So you can see these membrane, this is quadrangular membrane. This is vestibular ligament between the false vocal cord. This is vocal ligament. This is cricovocal membrane. This is concept. It is quadrangular membrane. You can see this is quadrangular membrane. Upper border from the epiglottic aryepiglottic fold. This is lower border from the false vocal cord. Upper border of conus elasticus from the true vocal cord. So this is two types of intrinsic membrane. Now the muscles of larynx. So all the muscles are adductor except posterior cricoarytenoid. It is abductor. So you have to remember this muscle only. Posterior cricoarytenoid, PCA. PCA is abductor. All other are adductor. Okay. Tensor is cricothyroid. Vocal is decrease the tension. Now the various intrinsic muscle, thyroepiglottic. If thyroepiglottic, so obviously it open the inlet. Thyroarytenoid, cricothyroid. Okay. Cricoarytenoid, inner arytenoid, and oblique arytenoid. Okay. And the other muscle is arioepiglottic, which closes the inlet. So the muscle which have epiglottis attached with the name are using in opening and closing the inlet. So the muscle which is thyroepiglottic, which opens the inlet, and the closing the inlet is by arioepiglottic. Okay. Now various spaces. So various spaces is pre-epiglottic, para-epiglottic, and Ranke spaces. Okay.